My name is Nurse Hattie, and today we're doing a procedure. It's called a fractionated procedure. I use a 1540 handpiece and a 15 millimeter point. The patient's face needs to be clean, and always make sure, because it is a laser, that you use glasses to protect the eyes. So her face is clean. I'm going to go ahead and put her glasses on. Go ahead and lift up your head. And basically, as you can see this handpiece, there's tiny little dots, about 100 to 150 little laser beams that come out of the tip that go into the skin, and they penetrate deep, producing collagen. This procedure is excellent for people that have had acne, or they've had some sort of scar and you want to even out the collagen production to lift up to a point where it will be even and it will look more beautiful. All right, so now I just turned on my machine. It's a little bit loud. It takes a minute to amp up. As soon as it amps up, I'm going to go ahead and set the milliseconds and the joules. Remember I said that the tip is a 15 millimeter. There's also a 10 millimeter piece, but that is for deeper collagen reproduction. All right, so now we're going to go ahead and set the milliseconds. I'm going to go ahead and do 20 milliseconds. I'm sorry, 15. We'll do 15 milliseconds. And the joules, I'm only going to go ahead and take it up to 7. This machine can go up quite high, so we want to make sure that the patient is comfortable but also gets a good result. All right, so now it's turned on, it's ready to go, and basically you want to have good contact, and I want to show you how it looks. We'll start with the eyebrows, the forehead. Oh yes, I need to put my glasses on too. All right, here we go. Yep. All right, so we're starting here, and you don't have to overlap. Basically, you can just barely touch each border as you're doing this procedure. Because this procedure is designed to build collagen, you will see the skin becoming tighter with each and every procedure. It takes about 6 weeks for the complete cycle to go through, and 6 months for the full collagen production. Are you okay?
Yes.
Okay, perfect. Okay, let's see how it looks. As you can tell, it's nice and pink. I like this especially because if you get Botox but you didn't get it soon enough, you might have the lines embedded into your skin. These are called static lines, and this will help erase them. All right. So now we're going to continue to go onto the cheek area. You want to do the whole face, and so and because we get wrinkles around the eyes, you can get fairly close. Like I said, this is perfect in building collagen, especially if you have large pores. Another good thing about this procedure is that if you have sebaceous hyperplasia, which is skin cells that grow upon each other, and then they look like little milias, little white milias, but when you get a facial and you try to pop them and have them worked on, it's really hard. They will not, they just stay on the skin. So you can't really, because it's part of your skin. All right, so here we go. We will continue to do this whole area, especially around the nose and the cheeks. I love this procedure also because if you have oily skin, this will decrease oil production. So that means your pores are going to get smaller. That means less bacteria being trapped in the pores. And so then that means less pimples, right? So it's an excellent procedure for post-acne or if you're still having acne, or even if you just have fine wrinkles. All right, thanks for watching.